Hello, my name is Kim, and these are my closing remarks for the debate. Should all healthcare providers be required to receive influenza or flu vaccinations? During this debate, both sides agree that influenza infection is a significant public health issue that requires concentrated efforts in order to reduce the associated burden in healthcare settings and beyond. They both agree that influenza immunization is a very effective strategy in preventing influenza and its transmission in healthcare settings, and that more should be done in an attempt to improve vaccination rates amongst healthcare providers. The following arguments were presented by myself, the opposition, in this debate. First, mandatory vaccine programs infringe on individual autonomy of healthcare providers. Second, not all seasonal flu vaccines are a good match to the circulating virus in any given year. Third, mandatory vaccine programs are difficult to implement, use considerable resources, and are typically faced with multiple challenges which can be detrimental to its potential success. Finally, education has been proven to be a very effective approach rather than mandatory vaccine programs to improve influenza vaccination uptake amongst healthcare providers. However, there has been some significant support for mandatory influenza vaccination programs for healthcare providers to improve the vaccination rates. This has been used as a means to increase vaccination rates by healthcare providers, as presented by the affirmative in this debate. However, for the various reasons presented by the opponent throughout this rebuttal, this approach is not warranted. While increasing the immunization rates of healthcare providers is an important goal, there is more than one strategy that can be used to achieve the overall desired outcome. The use of multiple influenza vaccination strategy in influenza programs designed for healthcare workplaces has been associated with an increased coverage amongst healthcare personnel. Furthermore, the fact that this requirement infringes upon the personal autonomy and rights of healthcare providers as individuals, and that there are preventative means that are available to prevent the spread of influenza, mandated vaccination cannot be justified. Internal and external stakeholders involved in this important issue need to focus on the successful strategies and obstacles that are well documented in the literature and allow healthcare providers to make informed decisions about their own healthcare while not jeopardizing the care they provide to their patients. Considering all arguments and evidence used in this debate, I restate my position that all healthcare providers should not be required to receive influenza or flu vaccine. Thank you.